I am the liver, and bilirubin metabolism is one of my essential functions. Bilirubin begins its journey with the normal breakdown of red blood cells. Red blood cells have a limited lifespan and are regularly broken down. Hemoglobin is released when red blood cells are destroyed. Hemoglobin is split into heme and globin components. The heme portion is converted into biliverdin. Biliverdin is rapidly converted into bilirubin. This bilirubin is called unconjugated bilirubin. Unconjugated bilirubin travels in blood bound to albumin. Albumin carries bilirubin safely to me. Liver cells take up unconjugated bilirubin. Inside my cells, bilirubin undergoes conjugation. I attach glucuronic acid to bilirubin. This creates conjugated bilirubin. Conjugated bilirubin is excreted into bile. Bile carries bilirubin out of liver cells. Bilirubin reaches the intestine through bile. In the intestine, bilirubin undergoes further changes. Gut bacteria convert bilirubin into urobilinogen. Most urobilinogen stays in the intestine. It becomes stercobilin, giving stool its brown color. A small amount is reabsorbed into circulation. Some urobilinogen returns to me. A small portion is filtered by the kidneys. Urobilin gives urine its yellow color. This is normal bilirubin metabolism. Excess red cell breakdown increases bilirubin production. This leads to unconjugated hyperbilirubinemia. Liver disease impairs bilirubin processing. This causes mixed hyperbilirubinemia. Bile obstruction prevents bilirubin excretion. This causes conjugated hyperbilirubinemia. Conjugated bilirubin darkens urine. Stool becomes pale when bile flow is blocked. Bilirubin accumulation causes jaundice. Blood tests help identify the type of bilirubin elevation. Treating the cause restores normal metabolism. Healthy liver cells maintain balance. Efficient flow supports normal bilirubin handling. Understanding bilirubin metabolism explains jaundice and hyperbilirubinemia